Salibonani Linjani, it's your host Ndlovu Primrose from the Girls Table podcast. In today's podcast, we're discussing on how lack of information on contraceptives, HIV and AIDS affects women, both the young and the elderly women who are deaf. And in this discussion, I had an interesting conversation with Mr. and Mrs. X. They asked to remain anonymous. They are a married couple who are both living with deafenism. They are both deaf. So Mr. X shared with me a bad touching story. He said there was a young lady ohambe New Start Center. Wafika New Start Center, and I believe sonke siyasthe New Start Center. The moment wengena, they'll all think vele ubuye for an HIV test. So wafika, she's a woman, she's a young lady. Wafika, they did the procedure, tester, and then they gave her the results. The bad part was the results said you're HIV positive. But what seemed to amaze Amanes was that when they told the young women that you are HIV positive, she smiled, waba happy, wathatha ama results akhe waphuma, with that happy face. And wayehamba, showing people the results. I went and you start saying, guys, I'm HIV positive. So now, with the way that she was acting, she was fortunate enough kwaba lo muntu wahlala phansi wambuza ukuthi, no, do you know what it means when they say HIV positive? And to her, the word positive means something good. Ngoba vele kahle kahle singathi positive, have positive thoughts, be positive. We are saying into enhle. And then the moment she says, no, don't be negative. Ungabi lama negative thoughts is now the opposite versus community as wrong. No, ungabi lento ungacabangi emibi. That's the word negative. So this is how the young lady took it. No, positive is good, negative is bad. So that's why she was able to share ama results without having any trouble. Because to her, positive meant something that was great. So someone sat down with her and they said, do you understand what ama results are kachon? Uthi nxa sisithi you're HIV positive kuchon. The young lady explained that no, we always say if it's positive, it's something enhle. So being HIV positive means something good. And then they had to explain it to her with no, when we say HIV positive, we are saying you have the virus inside your body. And when we are saying HIV negative, we are saying no, you don't have the virus. So from there, all of a sudden the mood, the attitude of the young lady changed. So what they observed, what they recognized, in hospitals there is a communication breakdown between the deaf community, the deaf people, and the people who are not disabled. They found out that one interpreter, someone who could go in between the patient and the nurse. So Mr. X brought it to light with this need ukuthi esibhedlela kube lo muntu okwanisa okwazi sign language, so that at least if the deaf women come esibhedlela for assistance, they are able to be assisted. And then Mrs. X went on to say, when we are looking at the issue of contraceptives, she's a woman, she's a mother. Wabe City, she wants to say, let us first look at the young women or the deaf women who are living in Makaya. They are lagging behind in terms of sexual health. She went on to say, the deaf women who are living at the rural areas, abahlala emakhaya, there is a lack of formal sign language. Why did she say that? The ladies who are in rural areas, they do not go to school as there are no deaf schools to accommodate them nearby. yikho apha abisa khona i-issue about inclusivity. What when we are looking at inclusive education, we are saying leaving no one behind, even lo muntu osekhaya kumele simfinyelele. But now when we are looking at the deaf child or the deaf young women, the deaf girl child, emakhaya akula skolo which cater for the deaf peoples or for the deaf children. Wathi iskolo zama-deaf zitholakala mostly in Bulawayo or in Harare. And how many families can afford to send their kids from emakhaya khona umncamo ubambile ekwanisa ukudinga imali ethi noma umntana mfundo ehambe esikolo sithi ebuye eBulawayo ebuye eHarare. And then she went on to say ukuthi mostly deaf schools, they are boarding schools, which means only those from well-up families can afford to attend school. So she went on to say ukuthi it's one, there's school inclusivity starting from school. When we are now looking at new curriculum, we're just looking at the syllabus at school. They start from primary or secondary level. We are being taught about contraceptives. So at least if someone angahambe school, whether you are deaf, whether you are disabled, whether you are not disabled, we can have that basic knowledge or itoluse school. And then she went on to say sometimes we can blame the government on a lack of inclusivity. But sometimes we have to bring it back to the families. How come other children without disabilities in the same school, in the same family, they go to school? So they brought up the issue about parental attitude. Parents who have abantwana who are deaf. What is your attitude towards the deaf child? It needs them to be cancelled. No, when you give birth to a deaf child, it doesn't mean or it doesn't mean you gave birth to someone. It means someone who's deaf can have a proper life. They don't have information that every child is unique and they can be sampled if accorded a chance in education. So they went on to say ukuthi kumele sibe inclusive ku education, the attitude towards abantwana. And then they say ukuthi what really needs to happen is this. We need a funding from the government or from someone ukuthi we bring in each and every community or society, started the deaf women, we educate them, we teach them on contraceptives and HIV and AIDS. If possible, siqalise at home, those who have relatives who are deaf. Share with them on sexual health, share with them information on contraceptives, HIV and AIDS. Is I want if we start from home, the society will also come in, and then the community, and then the country at large. They went on to say what sometimes it's hard, to go esibhedlela as a woman who is deaf, let's assume you are having a bad odor coming from your vagina, and now sofuna uhambe esibhedlela. So kumele ucabanga ukuthi kumele ngidinge someone who's going to interpret and still that privacy. No, le secret cause kubalutshwana umuntu ongagcina imfihlo ukuthi phela mhlawumphelekezela uzibaninyanana ngalesibhedlela bafika bambambi STI. You don't have that privacy anymore. Privacy yakho seseyaba invaded, because obviously the third person ohambe la esibhedlela ngale uzaphuma la one or the other soze kwanisa ukugcina imfihlo oyitsheliwe esibhedlela sangabuya it's a share labanye abantu. And to end the conversation, to end our discussion, they said their wish is to see every young woman who is living with a hearing impairment ekwanisa ukuthi ehambe esibhedlela efike ethole i-assistance abayidingayo. Because Mrs. X said sometimes one lady wathi ehambe esibhedlela esiyadinga ama-condom. The nurse was shocked to see someone deaf esiyadinga ama-condom. What? I see you also have sex. To show ukuthi kuwe. She was really shocked to see someone deaf esiyadinga ama-condom. No, because wayenza, it was a sin. Waqala sebiza someone khona ngalo moya nurse ukuthi akuzombonisa ufuna i-condom. They were shocked. And so she really said ukuthi if we all come together as one, we unite and we treat women who are deaf as abantu, as other women, other human beings. They've got feelings as well, and they've got the right to healthcare. And we all know what is sonkeni Islamanis. Alright. So to end the discussion, from your host, Ndlovu Primrose, I would like to say what you may all try to share information with young women who are deaf. If you are one who can do sign language or want sign language, you can write down for them simple terms. Because one issue that Mrs. X brought up, we got in. Sometimes we share our pamphlets on HIV and AIDS, we share our pamphlets on contraceptives, but the English written there is profess. So she brought out an issue with, if possible, we have a simplified pamphlets on HIV and AIDS, have simplified pamphlets on contraceptives, so that at least someone with a hearing impairment yakwanisa uzibhalela ezwisisa. And with that, would like to say thank you kini balaleli. It's bye for now.